can find only one articular space. But about the second, if you look at the costo-sternal joint, for the second costo-sternal joint, what happened? Here, the second costal cartilage is going to articulate with the monovibrium, with the body, and small part, the crest, is near the sternal angle. So, here in the second costo-sternal joint, we have two small articular space. But for the rest, only we have one articular space. Okay, do you get that? Now, here, you are going to look at the second costo-sternal joint. How many articular space you are able to find? Two, with one capsule. But about the other, only we have one space. Look at the interchondral joint. I told you the 10s go up, joint with the 9, the 9 go up, joint with the 8, and the 8 go up, joint with the 7. These interchondral joints are a kind of synovial joint. These interchondral joints also are a kind of synovial joint. And your classmate asked me about this platform that we call the sternum. Sometimes it is possible you need a sample of the bone marrow for the patient that you are not sure about the cancer, leukemia. You need a sample of the bone marrow. One of the bone that you can access easily is the sternum because it is near the skin and it is easy for you to access. After the sternum, the iliac crest, the superior border of the hip bone. This picture is going to show you the attachment of the muscle to the sternum. Now look at here. It is going to show you one of the typical rib. Posteriorly, it is going to make joint with two body of the adjacent vertebra, and anteriorly the position is inferior compared to the posteriorly, and the costal cartilage is going to make joint with the sternum. A typical rib, this picture I explained for you this morning, internal surface and costal groove. Do you remember?
Yeah.
Now it is the first rib and the 11 or 12 rib. This 12 rib and it is the first rib. Both of them belong to atypical rib. Why the first rib is atypical rib? Because it is very short and it has so many curves. When you look at to the superior surface of the first rib, you are able to find a ridge, a crest. This crest go medially and make a tubercle. In each side of the neck, we have scalene muscle. We have scalene muscle. One of the scalene muscle is coming down to attach to the first rib. So this tubercle in medial border of the first rib, this tubercle we call scalene tubercle. It is possible in comparative exam or in your final exam, we ask you, the scalene tubercle is visible in which of the following ribs? You should know the first rib, the scalene tubercle is visible in the medial border. The superior surface of the first rib, this crest is going to divide the anterior groove from the posterior groove. You should know, from the anterior groove, the subclavian vein is passing. From this posterior groove, the subclavian artery is here. When you have an artery, near the artery you can find a vein. Normally, the veins are pale, means one side and one vein this side. But sometimes they are single. Always the vein are going to protect from the artery. Means the vein are anterior to the artery. When you want to access to the artery at the first, you should remove the vein to be able to access to the artery. So these two groups are going to remember you this rule. This anterior group is the place for passing of the subclavian vein. Posterior, this group belongs to the passing of the subclavian artery. Look at to the costal cartilage that belongs to the first rib. It is flat and it is larger compared to the 12th rib. For the first rib, you are able to find the tubercle. For the 11th and 12th rib, we are not able to show you tubercle. For the first rib, after the tubercle, you are going to find the curve. Here, the called the angle. In the first rib, the angle is exactly a place that you can find the tubercle. But when you are coming down, for example, here, look at here, the tubercle is here. The tubercle is here. But the curve of the typical rib is going to appear here. Here is going to curve. So the angle is going to go far from the tubercle. For the first rib, the angle is exactly the same part that you can find the tubercle. But when you are coming down, then the ribs are going to get longer. The angle are going far from the tubercle. And this angle is a weak place that normally the fracture of the ribs are going to appear in the ankle. Okay? And you know the fracture of the rib you are not able to fix. For the forearm you fix, but for the ribs you are not able to fix. So the patient, it depends that one rib has broken or some of the ribs has broken. It is possible when you have several rib fracture, it is possible make problem for breathing, make problem for function of the lungs. But one rib broken, only during the sneezing, during the coughing, you have problem. After 2-3 weeks, everything disappears. It is going to fix by itself. And this picture also you can find in your book. Look at to the first rib, to the second rib. First rib, it is the tubercle. Angle is here. For the second rib, tubercle is here. Look at here, angle is going far from the tubercle. And if I has the third rib, you can find that the angle is more far from the tubercle. The origin and insertion of the muscle attachment to the bone are visible in these two pictures. In all of the atlas, the origin, you read about the muscle here. Yes? You read the pectoralis major. Okay. Look at here. For the bones, normally, the origin are going to be shown to you by the red color. And the insertion are going to be shown to you by the blue color. Here is the first rib. It is the scalene tubercle. Which muscle is going to insert here? Anterior scalene.
Subscapular?
No, anterior scalene muscle. Okay? We have anterior scalene muscle in each side, inferior, they are coming down and attached to the first rib. I told you, scalene tubercle is the attachment of the scalene muscle. Inferior is insertion of anterior scalene. It is going to attach to the first rib. Do you remember the subclavian vein, anterior to the subclavian artery? Another thing is the superior opening of the thorax. I told you, anteriorly the superior border of the monobaria. laterally the medial border of the first rib and posteriorly with the body of the T1. Please pay attention. The thorax, superior aperture and inferior aperture, superior opening and inferior opening are important. Look at this picture, it is possible. In your exam, I put this picture and ask you, what's the name of this group? What's the name of this group?
Costal.
Costal
View.
group. So, costal group is visible. And this picture, another question in the last semester, I asked from your friend about the inferior opening. Inferior opening of the thorax is larger than the superior opening. Inferior opening of the thorax is going to cover by the diaphragm. Which item are going to form the inferior opening of the thorax?
Could you repeat the question?
This is the question. Posteriorly,
the body of 12 vertebrae, thoracic
12.
vertebrae, and literally the 11 and 12 rib.
12 rib.
Yeah, and
Is of
literally.
the 11 rib. Yes.
Yeah,
And
anteriorly the costal margin
costal margin and
the xiphoid.
xiphoid. So xiphoid process, costal margin, tip of the 11 rib, 12 rib, and the body of the T12 are going to form the inferior opening of the
We can also
thorax.
add it that superiorly diaphragm, right?
Diaphragm is cover the inferior opening of the thorax. The diaphragm is going to cover, such as this picture, the inferior opening of the diaphragm. Because the diaphragm is dome-shaped, look at here, so some of the organs inside of the abdomen are going to cover and protect by the inferior ribs. Means the liver. Liver is the largest gland in our body. In adult, the liver is going completely to cover, to protect by the inferior ribs. But when you have hepatomegaly, when a patient, the liver gets larger, so some part of the liver is going to be found here in the hepatomegaly, during the injury, during the pathological time. Sometimes it is possible the gland of the liver gets larger. We call hepatomegaly. It is a disease. In this patient, some part of the liver is going to be found here, inferior to the costal margin. When you are going to FER, you are going to find that the liver is larger than the normal. Now, in this picture, you are going to look at superiorly, the superior opening, and in this picture, you are going to look at to the chest. Some of the ribs has broken. Here you have one of the ribs broken. Here you have several ribs broken and make the ventilation, make problem for the patient. And here, no. I wish to be able to finish, but yes, but it is not. Now look at here. Muscle in the thorax is easy because most of the muscles are the same to breathe in the upper leg. To be able to explain the anterior muscle, you